As a facial plastic surgeon, one of the most common complaints that people have when they come to the office is that they have wrinkles. So in this segment, we're going to discuss Botox and Restylane, or the other fillers, because that is what everyone asks about. Do I need Botox? Do I need a filler? And let's go over the difference between the two. Now, we have dynamic wrinkles in our face, and that's from the movement of the muscles. And you especially will see those in the forehead, around the eyes, and in between the eyes. So Botox will paralyze the muscles, and by paralyzing the muscles, it decreases the movement so that you will soften the appearance of the wrinkles in this area. Now that's completely different from your fillers, and the major fillers today are Restylane and Juvederm, and those are both hyaluronic acid fillers, and we use those a lot because you can't have any allergy to them, and because they give a very smooth, natural appearance. Now those work very well if you put them underneath the wrinkle. You can plump up the skin and decrease the appearance of the wrinkles in that area. So for the most part, Botox is used in the top part of the face, and your fillers, such as Restylane or Juvederm, will be used in the lower part of the face to help decrease the appearance of the lines and the wrinkles.
John, what causes these wrinkles? Is it simple aging? Does everybody get them, or is there a genetic component?
There's really a big difference, and it depends on the type of skin you have. It depends on your genes. Now, for example, the lines around the lips. Those can be genetic because even in your 20s you can start to develop those. It can be from the way you speak. If you tend to purse your lips a lot when you speak, you'll notice more lines. If you're a smoker, you're constantly making those, and you'll see more lines. Sun damage can create that. Having dental work done can decrease the support for the lip, and you can start to notice more wrinkles, and it's certainly an aging change. The same thing is true, for example, the wrinkles in the face. If you have very thin skin and you spend a lot of time in the sun, you're going to notice more wrinkles. If you have that thicker, more oily skin, you usually won't see any wrinkles in this area, or certainly a lot fewer wrinkles. Let's take a look at some slides, because I want you to see where we would use the Botox and where we would use the fillers. Now, the lines between the eyes are a perfect place to use Botox. And here we see these deep, what we call the glabellar folds. So what we'll do is put some Botox in here, and by paralyzing these muscles, you will start to notice a decrease in the appearance of the lines here. The forehead is another area. If you get a lot of wrinkles in your forehead from constantly lifting up your brow, by paralyzing this area, you can decrease the appearance of the lines in this area. And certainly the crow's feet is another area where you can dramatically decrease the appearance of lines, and by putting a little bit right in here, which is a muscle that pulls the brow down, you'll notice that the brow will be lifted up. Botox lasts for about 3 to 4 months in most people, so you do have to keep up with these injections if you want to keep yourself looking better. Now here, let's look at where we might want to be using the fillers. The nasolabial folds, here and here. A lot of people start to get marionette lines down in this area. If you want larger lips, or if you want to actually fill in the individual lines around the lips, you would use a filler such as Juvederm or Restylane. If you're thinking of having Botox or one of the fillers injected, it's very important that you go to a physician who is trained in doing these procedures. A lot of med spas are opening up now in malls, in different cities, and you really don't know who's going to be doing the injections. The problem with someone who doesn't know how to do these is if you give Botox incorrectly, you can get paralysis of muscles that you don't want paralyzed, you can get a droopy eyelid, and certainly from the fillers, you can get a lumpy appearance to your face, you could get an infection. So you really want to make sure that you go to a trained physician and not to someone who you have no idea what their training could be.
Good point.
How about, you see on TV ads for wrinkle creams, over the counter, you put them on at night and the next day the wrinkles are gone, or those are some benefit? Or?
Well, if they really worked, I'd be out of business. But there are some creams that do help with the appearance of lines and wrinkles. So if you tune in to our segment on skincare, I'll be discussing that more at length. All right?